What is CIN in cervical cancer? Imagine your cervix as the gateway between your uterus and vagina. Sometimes, the cells on its surface can change in ways that aren't normal but aren't yet cancer. This is what we call cervical intraepithelial neoplasia, or CIN. It's a term used to describe abnormal cell growth on the surface of the cervix, which is a very important part of reproductive health. CIN is considered a precancerous condition, meaning it's not cancer yet, but if left untreated, it can develop into cervical cancer over time. CIN is classified into 3 different grades based on how much of the cervical lining is affected. CIN 1 involves abnormal cells in about 1/3 of the surface layer. Often, these changes can go away on their own without any treatment, especially in younger women. CIN 2 affects about 2/3 of the surface, indicating a more moderate level of abnormality and a higher chance of progressing if not managed properly. CIN 3 is the most serious, involving abnormal cells in more than 2/3 of the surface, sometimes all the way through the full thickness. This stage is also called carcinoma in situ, which means cancer cells are present but haven't invaded deeper tissues yet. Detection of CIN usually happens during routine cervical screening tests like the Pap smear, which looks for abnormal cells. If abnormal cells are found, a biopsy is performed to confirm the diagnosis. The main cause of CIN is persistent infection with high-risk types of human papillomavirus, or HPV, which is a very common sexually transmitted virus. Most people who get HPV clear the infection naturally, but in some cases, the virus can cause these abnormal cell changes. How CIN is managed depends on its grade. For CIN 1, doctors often recommend careful monitoring with regular follow-up because it can resolve on its own. For CIN 2 and CIN 3, treatment is usually necessary to remove or destroy the abnormal cells and prevent progression to invasive cancer. Procedures like loop electrosurgical excision or cone biopsy are common options. These treatments are effective at preventing cervical cancer and are generally safe, with the goal of preserving reproductive health whenever possible. Understanding CIN is vital because early detection and treatment can significantly reduce the risk of developing invasive cervical cancer. Regular screening programs are designed to catch these abnormal changes early, giving women the best chance to stay healthy. Remember, if you have concerns or questions about cervical health, it's always best to consult a healthcare professional who can provide personalized advice based on your medical history. Staying informed and proactive is the key to protecting your reproductive health and preventing cervical cancer.